Thank you, Mr. President. I want to start by thanking my colleague from the state of Connecticut for bringing those powerful testimonies to the floor of the United States Senate. And it's really important that all of us, all 100 of us, spend time back home in our states listening to people who are telling us those kind of stories. I've gotten over 2,500 phone calls in my office just since Thursday, all of them strongly opposed to this health care proposal, so-called health care proposal. You know, Mr. President, some things improve with time. Some things improve with age, like red wine. Some things get stinkier and smellier the longer they sit out there, like rotten things. And that is the case with the series of Republican so-called health care bills. Trumpcare 1, Trumpcare 2.0, now Trumpcare 3.0. They're all rotten to the core, and the more they sit out there, the stinkier they get, and the American people know it. If you had any doubts, take a look at the most recent Congressional Budget Office report that we've got today. And there's a pretty clear pattern between all these Congressional Budget Office reports on the first bill we saw, on the second bill, and now on this latest version. And here's the pattern, Mr. President. Tens of millions of Americans will lose access to affordable health care in the United States of America in order to provide tax breaks for powerful special interests and richer Americans. That's the pattern. In this most recent report, we're told by the nonpartisan professionals at the Congressional Budget Office that 22 million of our fellow Americans are going to lose access to affordable health care. And for what? To give powerful special interests a tax break and wealthier Americans. You know, insurance companies can actually currently are not allowed to deduct the bonuses they pay to their CEOs. Now you're going to allow insurance companies to deduct the bonuses they pay to CEOs. And while tens of millions of Americans will lose access to affordable care, millionaires in America will get an average annual tax break of $50,000 a year every year. So make no mistake, you can call this a health care bill, but it has nothing to do with health care and everything to do with wealth care and transferring wealth from more struggling, vulnerable Americans to the very wealthy. Mr. President, if this was about health care, why is it we've all gotten in our offices long lists from patient advocacy organizations that are dead set against this legislation? These are organizations that have been dedicated to trying to improve health care for people and patients in our country. The American Cancer Society, the American Diabetes Association, the American Heart Association, the American Lung Association, National Alliance on Mental Illness, National Breast Cancer Coalition, National Multiple Sclerosis Society, and the list goes on and on, from organizations that have dedicated themselves to advancing patient health. And on the other side, I haven't seen a single, not one, patient advocacy group that's come out to support this so-called health care bill. How can that be? If this is good for the health of our fellow citizens, why is it we have a long list of organizations that are dedicated to that cause against it and not one for it? How about healthcare providers, the folks who help provide the care to our constituents? They're all dead set against it. The nurses, the doctors, the hospitals, the people who have that network of care. I was just out on the Eastern Shore of Maryland, rural part of our state. The rural hospital associations are opposed to this bill. They know that the people they serve are going to be badly hurt. And by the way, it's also going to hurt the economies in those parts of our state, especially the rural parts of the states, because those hospitals depend heavily on many of the people who get help through the Affordable Care Act, whether through the exchanges or through expanded Medicaid. And as those patients come in the door and no longer can pay for their care, those hospitals said they may have to close down operations, lay people off. A double whammy, bad for patients and bad for those who provide the care to our patients. That's why AARP has been all out against this, because they know that for Americans between the ages of 50 and 64, before you get on Medicare, this is a total disaster. As they've said, there's an age tax. If you're older, you're going to pay a whole lot more under this Republican bill than you pay today. And many people are just realizing now, as they follow this debate, that 2 out of 3 Americans who are in nursing homes today are supported by Medicaid payments. So millions of our fellow Americans who now get their care in nursing homes, where Medicaid is providing support for 2 out of 3, are going to be put at risk and made vulnerable because of this legislation. Remember, Donald Trump said he wasn't going to cut Medicaid. This cuts it by over $750 billion. And make no mistake, on this issue, this Senate bill is a lot meaner than the House bill. We all know that President Trump, out in the Rose Garden, he celebrated the passage of the House bill, but behind closed doors, what do you call it? Mean. This Senate bill, as time goes on, will cut Medicaid far more deeply than the House bill. As you look at this Congressional Budget Office report, it talks about how you get to the end of year 8 and 9 and 10, and you go beyond that. You're going to have very deep cuts, much more painful, much meaner than in the Senate bill. And Mr. President, we've heard a lot about pre-existing conditions. The reality is the Senate bill is very devious in this regard. It's a great sleight of hand. On the one hand, it creates the impression that if you've got pre-existing conditions, you're going to be all right. But what it pretends to give with one hand, it takes away with the other and makes those Americans vulnerable as they were before the passage of the Affordable Care Act. And I'm not talking about those who are directly benefiting, like those on expanded Medicaid or those in the exchanges. I'm talking about those who are benefiting from the patient protections in the Affordable Care Act. I just got a note the other day from Mark in my state of Maryland saying, my son was diagnosed with Crohn's disease in 2008 at age 18. He was repeatedly denied insurance and was only able to cover part of the cost of care through the Maryland high-risk pool. It was Obamacare that made it possible for him to be insured and care for his disease. It was Obamacare that, quote, will literally save his life, unquote. And we have many stories like that from others who were denied access to care because of pre-existing conditions before the Affordable Care Act. Mr. President, there's another major sleight of hand in this Senate Republican proposal, and that relates to premiums. I've been listening, we've been hearing a lot from our Republican Senate colleagues about how this is going to bring down the price of premiums. Mr. President, we all know that what Americans care about is what they're having to put out total for their health care. Premiums. How much is the deductible? Oh, great, I got a lower premium, but my deductible is now $10,000. Co-pays. And here's the dirty little secret if you dig into the Congressional Budget Office report. After listening to many of our Republican colleagues talk about premiums, now you got to translate a little bit here because this is in the budget tease of the Congressional Budget Office. What they say on page 9 is, and I quote, "Some people enrolled in non-group insurance," in other words, in the individual market, the people who are currently in the Affordable Care Act exchanges, "would experience substantial increases in what they would spend on health care, even though benchmark premiums would decline on average in 2020 and years later." So translation, in some cases, the premium, right, that sticker price may go down, but you're going to end up paying a whole lot more when it comes to your deductible and your co-pays. It goes on to say, because non-group insurance, in other words, the individual market, would pay for a smaller average share of benefits under this legislation, most people purchasing it would have higher out-of-pocket spending on health care than under current law. And it goes on and on. In other words, keep your eye on the ball, America, because when someone tells you your premiums are going to go down, watch what happens to all your other health care costs. And the Congressional Budget Office, the nonpartisan analysts are telling you they're going up. So, Mr. President, this brings me to my final point. I said at the beginning that some things get better with time and some things get stinkier and smellier. We know that the more the American people get a look at this latest Senate Republican proposal, Trumpcare 3.0, we know the more they get a look at it, the less they're going to like it. The more they see it, the more they'll hate it. Just like something that's rotten gets stinkier with time, this will get worse and worse with time. And you know, Mr. President, that's why it's so important that we not try and jam this thing through the United States Senate. I understand the Republican leader. He knows this thing is rotten to its core, and he knows the more it sits out there, the more people are going to see what it's all about, and the more they're going to hate it. So let's have a full debate, and let's make sure all of us go back to our states over the 4th of July, to the parades and the barbecues and the picnics, and look our constituents in the eye and tell them that we're going to take away health care for tens of millions of Americans, that we're going to open up the discrimination once again to pre-existing conditions. We're going to increase their overall health care costs, even though we tell them we're going to be reducing them. Let's look them in the eye and tell them what this bill is all about, rather than try and push it through in 24, 48 hours or later this week. Our constituents deserve to know the facts, and we need to make sure we vote to protect the interests of the United States of America, not just provide another round of tax breaks to powerful special interests and millionaires. And I thank you, Mr. President.